people are putting this on the fact of the historic distrust of the vaccine. And I get that we have that. Nobody knows more about that stuff than black doctors. You know what I mean? But the issue is right now, African Americans and Latinos are not getting access to the vaccine. And let's not put it on this historic distrust as much as it is access. We don't get access to great quality medical care. We know that if you're a black man, you don't get the appropriate care when you go into an emergency room. If you have a chest pain, and this is not stuff that we're just making up. These are facts. These are studies that were put out by major universities. If you're a young black kid, you do not get the best care when you go into hospital. In fact, if you're a young black kid and you are admitted to the hospital, if you don't have a black doctor taking care of you, the odds of you dying go up. So these are data points that we know. So we cannot divorce the social determinants of health from vaccines, just like we cannot divorce the social determinants of health when it comes to access to care. We can't miraculously think that black people and Latino people don't get good health care for the last 100 years, but all of a sudden we get the vaccines. No, that's not going to happen. So what we have to do is make sure that we hold this group that was sitting in front of us today, the CDC, accountable for the ability for African Americans and Latinos to get this vaccine. We cannot let them get out of the fact and put it on this historic distrust anymore. The whole concept of vaccinations to prevent the disease. And I will go one step further and to say, I want everyone that's listening to go look up the story of Oneismus, the black slave of Cotton Mather, who is the father of American vaccination. And that statue is standing in Boston right now. He, a slave, actually invented, quote unquote, brought that whole concept of vaccination to Boston during the smallpox epidemic in the 1700s. So we don't want to be scared of vaccines, but we are, but not as much as they're holding the vaccines from us.